Good afternoon, everybody. I am Dr. M. A. Muqsith Quadri, MD General Medicine, consultant physician, and diabetologist at Kamineni Hospitals in Koti, Hyderabad. Today, I'm going to be speaking to you about hypertension. Basically, we have to understand what is hypertension. And on World Health Day, we will take this opportunity to discuss on what high blood pressure and how to prevent it. Usually, everyone would like to have a healthy or normal blood pressure. But what exactly does it mean? Basically, each time when the heart beats, it pumps blood into the blood vessels. This creates pressure against the walls of the blood vessel. This is called blood pressure. Normally, in a healthy person, it rises and falls throughout the day. But when the blood pressure remains high for a longer time and is left untreated, it can lead to serious health complications. In general, a persistent increase in blood pressure higher than normal blood pressure is known as hypertension. Hypertension can develop over long period of time. It generally presents because of an unhealthy lifestyle, like not having regular physical activity, obesity, smoking, high alcohol consumption, and stress. Other risk factors include age, family history of high blood pressure, excess salt intake, and eating processed and fatty foods. Moving on, hypertension does not have obvious signs and symptoms. That is why it's often called a silent killer. Measuring blood pressure is the only way to know whether a person has high blood pressure or not. If a person is experiencing some of the symptoms, then one should get their blood pressure checked. Symptoms like having neck pains, dizziness, uh, headaches, regular headaches. All these things are some signs of signs and symptoms of high blood pressure, but not everyone presents with them. Healthy or normal blood pressure should be lower than 120/80. If the blood pressure level is more than 140/90, then the person has hypertension. If a person has BP levels higher than this, then he or she may be at risk of developing serious heart disease. This risk can be prevented and reduced by taking steps towards a healthier lifestyle. So let's look at these strategies one by one. First, regular exercise and physical activity. Exercise can be a drug-free approach to lowering high blood pressure. Regular physical activity makes a person's heart stronger. Consistent exercise also helps you maintain a healthy weight, which, in my opinion, is an important way to control blood pressure. One should aim for at least 30 minutes of aerobic activities on most days of the week. High BP levels can be reduced by doing regular, structured exercises such as brisk walking, jogging, or swimming. Second, a healthy diet. Diet also plays an important role in controlling blood pressure. A diet with high intake of vegetables, fruits, and whole grains is recommended for hypertensive patients. For lowering blood pressure or preventing hypertension, we have a diet called the DASH diet. What does DASH stand for? It's dietary approaches to stop hypertension. It is rich in whole grains, fruits, vegetables, and low fat dairy products, and skims on saturated fat and cholesterol. And that will help in lowering the blood pressure by up to 11 millimeters of Hg if he has high blood pressure. Another thing in the diet that is important is reducing sodium. Even a small reduction in the sodium in diet can improve heart health and reduce blood pressure by 5 to 6 millimeters of Hg. If you have high blood pressure, to decrease sodium in your diet, read the food labels and, if possible, choose low sodium alternates to the foods and beverages you normally buy. Eat fewer processed foods. Most sodium is added during processing, so you can try to eat as much as possible as you can natural products, and also try not to use the delivery system. That is the common trend nowadays. Let's make your own meals at home and stop using the Swiggies and the Zomatos. Thirdly, if you are a smoker, quit smoking. Stopping smoking helps you to reduce your blood pressure and bringing back to normal. Quitting smoking can effectively reduce the risk of on your heart for further development of heart disease, and it will also improve your overall health. Fourthly, regular blood pressure monitoring. Some of the hypertensive patients check their blood pressure only while visiting doctors. This is not correct. Home monitoring of blood pressure is very important. There are certain rules to follow when you monitor blood pressure at home. Firstly, the patient should be sitting for at least 5 minutes before checking the blood pressure. Secondly, the patient hand and the BP machine should be on the same level. Thirdly, it should be checked at random times during the day. Self-monitoring helps a person to measure BP at different times throughout the day and over a longer period. It gives a better picture to the doctor to maintain or change the BP, medication of the patient. Fifth, stress management. By learning how to relax and manage stress, you can improve emotional and physical health and lower your blood pressure. Stress management techniques include exercising, listening to music, focusing on something calm or peaceful, or meditating. Lastly, adherence to medication. If you have been started on medication, please do not change it unless until recommended by doctor.